So for the neck massage, I would normally do my tension treatment, which is 3/4 of an hour, and I would do the lower back, shoulders and neck in that length of time. So before I turn the client over to do most of the neck movements, I'm just going to warm up the neck from the prone position and effleurage from the top of the couch just to warm up the neck, and then do some knuckling across the top of the supraspinatus, and then just a little bit further down. Now, bearing in mind I would have already warmed up and massaged the shoulders, so using your knuckling movement from the spine rather than on it, and coming out to the side. This is a really nice movement and it saves your thumbs and your fingers. And if you come up the neck as well, your knuckle fits really well into this curve in the neck and the shoulders. So we can do some frictions as well, putting the thumbs under the trapezius on the shoulders, and then we're going to go round with the rest of the hand and then reverse it. So if you ask your client to point their head down towards the floor, you'll see if you can do it a little bit more than that. So they really are pointing, and this is coming up. So even more, a bit more. Your head down toward forehead to the floor. That's it. So the head, the neck comes up, and you get a lot better access to the neck. So we're going to go in for some specific effleurage up into the occipital ridge to warm up the muscle. How's the pressure there? Is that all right? And then here we're in a very good position to get to the scalenes, just behind the sternocleidomastoid. The scalenes can be quite a painful muscle. It shortens from the first rib up into the neck. So the scalenes, quite a useful one to be able to get to. So we're going to effleurage up into the occipital ridge. And then I like to do some frictioning. So along the occipital ridge from one ear to another, warming it up and getting to the attachment where the muscles attach to the occipital ridge. So this is going to help warm up the neck, moulding your hands, the contours of the body, keeping that flow, not losing any contact. And you can see a nice bit of erythema to show that we've warmed it up. So we're going to flick it away, and then we're going to turn the client over. Okay, so making sure that your client's neck is over the hole in your couch. And we're going to bring the towel down to expose the pecs, because even on women, the top of the breasts are muscles which we need to be able to relax. They work very much with the rhomboids on the other side, so we need to make sure that we loosen up the pecs as well. So I'm going to use a white lotion rather than an oil, because I do find that most of my clients are a little bit sensitive about having an oily face and neck after the treatment. So I find that white lotion is a lot more viscous and it doesn't leave an oily residue like oil does. So just enough, and I'm going to lubricate it in a nice continuous way so that we're not going to lose any contact. There we go. We don't need a huge amount, but it does absorb very quickly. So I'm just going to put a little bit more on. That's it. So we're going to start on the chest with effleurage. I'm going to come across and around the shoulders, underneath, and pulling the hands up to the occipital ridge. We're going to lift and hold, and then effleurage back down the neck. So I'm coming underneath the neck and pulling either side of the spine. So not on the spine. My hands are coming up towards me, fingers towards me, and then I'm going to lift and hold. And that gives a really nice traction on the neck. So we're coming up towards the head, lift, lower, and not losing contact. I'm going to slide my fingers back down onto the chest, and then again up. Now the chin should come up and then down if you do this really well. Then we're going to knuckle. So I'm going to knuckle across the pecs, individual knuckles rather than a solid knuckle, I find works better. And when you come underneath, you're going to sort of be like a dead spider on its back, and you're going to work underneath, and you should be able to find any knots in the rhomboids. Is that all right? That's not too much.
That's fine.
And then you're going to come over the top, which I can feel is very lumpy on the right hand side with lactic acid crystals, and under the neck itself. So again, sliding back onto the chest, not losing contact, down the arm, down over the deltoid, underneath. So we're getting through the trapezius, some lovely lactic acid crystals crunching there. And then we're going to come up over the top, supraspinatus and the upper traps, and then into the neck again. And then effleuraging down to link, and a bit more traction to really warm up the muscles that you're going to be working a little bit more deeply on. As well as the neck, I like to include a little bit of massage onto the face, just so that the client then relaxes their face muscles. So just keeping contact on the cheeks. I'm going to use a nice firm effleurage across the forehead to relax the muscles, the corrugator, the frontalis, going across towards the temporalis from the middle, and coming back a nice smooth effleurage towards the hairline, and back again towards the eyebrows. Then I'm going to use the full hand sweep from one side of the forehead to another. And you can even do it if you've got quite a large forehead to work with. You can go eyebrow to scalp. I'm going to have a couple of circles, 2 fingers, middle and index finger. Doing some nice circles on the temples, not too firm but not too light either. And then I'm going to come down onto the cheeks. Loosen up the cheeks, pterygoid muscles, the masseter. And then again down onto the face, onto the chest rather, coming up underneath, coming down onto the chest and around. So having warmed up the chest, I'm going to turn the head to the left, have a little bit more lotion, and I'm just going to effleurage down over that far shoulder and back, sweeping up right the way up to behind the ear and warming up the neck. This time I'm going to come from the middle up with one hand and down with the other. This is going to give a nice stretch to this side of the neck. Now, one of the things I find with doing the neck massage is if you have somebody with a stiff neck and you leave them too long on one side or the other, then their neck will often go into spasm. So we want to try and avoid that spasm by effleuraging and doing a little bit on one side and a little bit on the other. Unlike the shoulders, where we did one complete massage on one side and then did the other, with the neck, I'm very mindful that when you have somebody with neck pain, you need to make sure that you alternate the side you're working on a regular basis to prevent it going into spasm. Also, you have to be careful how far you turn the neck. You're not going to force it into a further rotation than the client is comfortable with. So you do need to make sure that you just take it slowly when you do your turn and you don't yank your client's neck too far. So we're going to go back the other side. That's it. Lovely. Now I'm going to put my hand underneath the neck, fingers coming out the other side, and I'm going to pull through. So I'm pulling the muscles on the left side underneath and sweeping up the back of the neck on the right. So this is where your hole in the couch is very useful, gives you space to work. And I'm going to turn and pull the other side. So pulling those muscles through with the fingers. You feel that's a bit tense there, isn't it? Yeah. And then we're pulling through and up each side. So again, rotating the neck, not taking too long on one side rather than the other. And this time I'm going to lubricate and I'm going to find C7, which is the really sort of sticky out lumpy vertebrae at the bottom of the neck. And I'm going to come out about 1/2 inch and using the middle finger, I'm going to do some really nice deep circles on that muscle. And just coming a little bit further towards me each time. I'm doing a row, I'm about 1 inch out, and I should be right on top of the splenius capitis and the trapezius, and I'm coming up the side of the spine, right the way up to the occipital ridge. So I'm on a whole row of different muscles there, and when I get to the occipital ridge, I'm just going to carry on with these circles. And then I'm going to come across under the occipital ridge, along the hairline, again with quite deep little circles all the way along, around the back of the ear, and then a pressure walk around the ear, and then a really nice squeezing and kneading, petrissaging of the earlobe. I'm going to effleurage down and do the whole thing again. So again, I've found C7, I've come out 1/2 inch to 1 inch, and I'm doing circles, and it feels really tight in here. Starting to crunch a little bit now. The lactic acid crystals surge into the muscle to give it energy. The lactic acid gives the muscle energy. It's a byproduct of non-aerobic exercise. So when it doesn't drain away at the end of using a muscle, it crystallizes, and those crystals can be the size of a pea or a golf ball, and the body finds it hard to eliminate, and these lactic acid crystals can press on the nerves, on the blood supply, and by worrying them with our movements we can help to break them down, a bit like a sugar lump, so that these lactic acid crystals, which sometimes can be the size of a golf ball, particularly hiding in the shoulder and the neck muscles, and we can break them down so that eventually they can rub together and break down into fine granules, and the body can eliminate that lactic acid. So again, repeating the same routine, we're coming round the ear and we're going to petrissage the earlobe. And then I'm going to effleurage down. I might do that 3 or 4 times. This neck massage can be as long or as short as you want it to be. It could be 10-15 minutes if it's part of a tension massage, or it could be, if you're doing it on its own, you could do it for half an hour. I've even done a head, face and neck treatment for an hour. So as many rotations of those movements as you want. Otherwise I'm going to go around the other side, a little bit more white lotion for lubrication. Make sure it's not drying out or pulling on the skin. Obviously you need more lotion if you've got a hairy body. But I'm going to find that C7. I'm going to bring the middle finger out about 1/2 inch to 1 inch, and there I can feel a nice taut muscle. How painful is that one?
It's about a 7.
About a 7, yeah. I can feel it twanging under my fingers, so we'll just gently worry that on for a bit. God. And then we're going to move up, follow it up towards the occipital ridge, onto the occipital bone. A lot of attachments onto the occipital bone, especially the trapezius. And then we're going to follow along just under that ridge, nice firm circles. It's going to alleviate. It's where a lot of people with tense muscles tend to have headaches. A lot of headaches stem from the neck. Just watch your pressure. Make sure you're asking your client how painful it is. You don't want to be applying too much pressure, because you can stimulate a headache if you work very deeply into this area. It can be a sort of possible reaction to treatment for the neck massage. Then we're going to do a pressure walk around the ear and end up giving it a good scrunch, giving it a good kneading. And then effleurage back and around and do another row. So I'm just going to do 2 of these just to show you. I've found C7 and I'm just on the muscles running by the side of it. I'm going to loosen that one up. What number's that? 7 or 8. Okay, do you want me to ease up a little bit? So we're looking for a 7 really, a sort of pleasurable agony. It feels uncomfortable, but it feels as though it's doing you some good, rather than just a pain at 8, 9 or 10. So we need to be working to the client's pain threshold. There's nothing worse than having a treatment that's not deep enough to find a muscle, but at the same time you don't want to lie there gritting your teeth thinking, I'm never coming back again, this is too much. So the first treatment, I always explain to the client, is about communication and learning what sort of pain threshold you've got with the client that you're massaging. So we want to try and get it just right. And again, we're going to go round the ear and then petrissage the earlobe. And then we're going to turn back to the middle. I'm just going to bring my finger circles either side. I'm just going to massage sternocleidomastoid, splenius capitis. We're on the scalenes, getting a little bit into the levator scapula there as well. And then this time I'm going to come across the chest, down the arm, and I'm going to overlap my hands this time so that I can come up underneath the neck, thumbs out, and I'm going to literally pull and traction all the way through under the hair, but come back one at a time so I don't lose contact. So pulling all the way back under the hair and back one at a time. So this is not a movement you would use on anybody who has a spondylitis, cervical spondylitis of the neck, or an undiagnosed whiplash. So do have a look at the contraindications on the presentation before you do your neck massage. And I like to make sure that I do this area thoroughly, so I'm going to finish with some nice firm frictions of the scalp. So moving the scalp over the skull rather than shampooing. I find it a lot more effective if you can move the scalp and then move your hand. And we're going to cover the whole of the scalp nice and firmly. If you watch your client's face throughout, then you'll soon see if something's a bit firm. You'll see a wince, and you'll also see if they're nice and relaxed. And if they're snoring, you know it's really good. So we're going to cover the whole of the scalp with these very deep frictioning moves. The whole idea is you shouldn't hear the hair crunching. And if a client does have hairspray on, then you don't get your hands tangled up in the hair either. And you shouldn't really upset their hairstyle too much. A good head massage leaves their hair virtually intact but relaxes the scalp. So we're going to finish at the occipital ridge. And then again turning by putting the hands over the ears, leaving it to support underneath. And then we're going to start again at the occipital ridge this side. Paying attention to the hairline, especially behind the ears. This can be a very tense part of the head and the scalp. And you learn how to feel tension in the scalp, because where the scalp doesn't move over the bone is where it's often very painful, and you get a build-up of tension between the scalp and the skull. I've found in the past that this is a good preventative for people who get repetitive headaches and migraines, and they tell me they get less incidence of headaches and migraines as a result of this. So we're going to friction and come down, finishing on the occipital ridge again. I'm going to turn the head back to the middle and effleurage all the way through to finish. And I'm going to do a few stretches for the neck, which is really useful for improving the mobility of the neck. So the first one I might do is to get the client to deep breathe and take a deep breath in and out, and I'm just going to push the head, the chin to the chest, get the client to deep breathe and just relax and breathe and hold for a minute or two. Then we're going to take it off and we're going to get the client to breathe in and out, and this time it should go a little bit further. Is that comfortable? We're going to leave it and hold for a few minutes. And then we're going to take it off. And again, we're going to get the client to breathe in and out. And we're going to come up, and it should go just a little bit further. So this is a neuromuscular technique, a stretch, which just pushes the muscles a little bit further. And then we're going to do another one. We're going to bring the ear to the shoulder, and we want the client to face the ceiling, so we want to keep their head straight. I'm going to put the hands on this side of the head, and I'm going to get the client to push towards me. So push 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. So then we're going to take it off so we don't get it in spasm. We're going to bring it this side, ear to shoulder. I'm going to get the client to push 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. And each time they push, they only use about 40 to 50% of their strength. So they're not straining themselves. And push 1, 2, 3, 4, 6, 7, 8, 9, 10, and relax. And each time you should see that the ear gets closer to the shoulder. So push 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. And again. Push 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. One more on the other side, and you can see we're nearly at the shoulder. Push 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And then we can do this one. We're coming up chin to chest. Get the client to push down on your hands. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Lovely. And again, we're coming up and push. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And down. And then one more. Breathe in. And up. Push. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And down. And if you like those movements and you feel it adds a little bit of extra stretch for your clients, I've got a whole video CPD course on those different stretches on different parts of the body, and a few more ideas on which muscles to use them on. So there we are. We're going to tuck the client in, leave them for a few minutes to come round, because that can be quite a powerful treatment and people really relax into it nicely. So you might go away, wash your hands, tell your client, I'm just going to leave you for 5 minutes to come round. And some clients would like to have a pillow, so I might just pop a pillow underneath. Make sure the client's nice and warm. So head facing neck, we covered all together in that treatment, but focusing on the neck. So that's your neck massage, deep tissue to go with your back, shoulders, head facing neck.